Okay, let's dive right into this explainer. We're looking at a disease that's been around forever, but is still a massive medical emergency today. Cholera. Now, this acute diarrheal illness has literally shaped human history with some devastating global pandemics, and yet it's still causing major public health crises right now, especially in places hit by conflict, natural disasters, or where sanitation just completely breaks down.
But right off the bat, I want to share a number that completely flips the script on this disease: less than 1%. Honestly, that is the astonishingly low mortality rate of cholera if it's treated promptly, which is kind of mind-blowing for an illness that, left unchecked, drains your body so fast it can actually be fatal in a matter of hours. The good news? We have the tools to beat it, and figuring out exactly how is what this whole explainer is about.
To see how we get to that sub 1% mortality rate, here's our quick roadmap. We're going to cover 1. The microscopic threat, 2. Transmission and symptoms, 3. Diagnosis and danger, 4. The race to rehydrate, and finally 5. Prevention and global outlook. Let's get into it.
Starting off with Section 1, the microscopic threat.
So meet the villain of our story, Vibrio cholerae. What's actually really fascinating about this bug is its shape. It's this gram-negative, comma-shaped bacterium rocking a little tail-like structure called a flagellum. That flagellum basically acts like a tiny outboard motor, making it super mobile. And this pathogen is tough. It forms these biofilms that let it survive and even thrive out in aquatic environments way before it ever enters a human host. Specifically, it's the serogroups O1 and O139 that we really have to watch out for, as they drive the severe global outbreaks.
Okay, so how does this tiny thing cause such utter chaos once it gets inside you? Well, it's basically a step-by-step biological hijacking. You consume contaminated food or water. The bacteria brave your stomach acid, make it to your small intestine, and latch right onto the lining. Then comes the critical move. They release cholera toxin, or CTX. This toxin is a cellular hijacker. It activates an enzyme in your cells called adenylate cyclase, and that sets off a massive chain reaction. The end result? Your intestinal cells are literally tricked into opening their floodgates. They dump massive amounts of chloride ions and water straight into the gut. Your body basically turns into a runaway water pump, causing immediate severe dehydration.
Moving on to Section 2, transmission and symptoms.
The really crucial thing to understand here is that cholera is an opportunist. It exploits systemic vulnerabilities. It spreads almost entirely through the fecal-oral route. Basically, it thrives wherever drinking water or food gets contaminated, or where community sanitation is poor, like open defecation. This is exactly why we see these massive, terrifying spikes in cholera cases right after natural disasters, like floods, or in war zones and refugee camps where the water infrastructure has just totally collapsed. And while anyone can catch it, children, folks struggling with malnutrition, or people with lower stomach acid face a much, much higher risk.
Once you're infected, things can escalate super fast. Symptoms might show up in a few days or literally just a few hours, and there's a huge difference between mild and severe cases. Mild to moderate, you're looking at frequent watery diarrhea, vomiting, some serious thirst, and weakness. But severe cholera, it is unmistakable and incredibly dangerous. Patients develop what we call rice water stools, which is the classic textbook hallmark of the disease. Throw in severe muscle cramps, sunken eyes, a racing heartbeat, and blood pressure that just absolutely tanks. Their extremities might go cold, and urine output basically stops because the body is in full-blown panic mode from the fluid loss.
Which brings us to Section 3, diagnosis and danger.
When a patient comes in crashing, doctors are in an absolute sprint to figure out what's going on. They have to differentiate cholera from other things like typhoid fever or viral stomach bugs like norovirus. The dead giveaways for cholera? That unbelievably rapid dehydration and the signature rice water stool. It looks totally different from typhoid's gradual fever. Now, doctors will definitely use rapid tests and ask about travel history, but the absolute gold standard to confirm it? That's a stool culture.
But we really need to emphasize the danger here because the timeline is incredibly compressed. If we don't treat this immediately, that massive fluid drop tanks the blood pressure instantly, and that leads straight into hypovolemic shock. Essentially, the body literally doesn't have enough blood volume left to keep the heart pumping. It's terrifying. From there, severe electrolyte imbalances can throw off the heart's rhythm, the kidneys shut down, and multi-organ failure kicks in. Without intervention, death isn't just a possibility, it's a very fast reality.
All right, Section 4, the race to rehydrate.
Luckily for us, medical science fought back. If we trace the history, back in 1854, physician John Snow did some legendary epidemiological detective work. He traced a huge London outbreak right back to a single contaminated water source, the Broad Street Pump. That literally laid the groundwork for modern water sanitation. But the real silver bullet came in the mid-20th century when we developed oral rehydration solution, or ORS. Honestly, this simple concoction completely revolutionized treatment and is the bedrock of how we fight cholera today.
Those historical wins gave us the incredibly precise, evidence-based protocols used by the WHO and CDC right now. Step 1 is always an immediate assessment of the dehydration level. If it's mild or moderate, boom! Prompt administration of WHO low-osmolarity ORS. That's usually all it takes. Its chemistry is perfectly balanced to use the gut's sodium-glucose transport system to literally pull water back into the body. Now, if it's severe, we skip straight to rapid IV fluid, specifically Ringer's Lactate, to get blood volume up instantly. Doctors will selectively use antibiotics like Azithromycin to shorten the whole ordeal, and definitely zinc supplements for the kids. And of course, keeping up with nutrition and breastfeeding is absolutely crucial for recovery.
Finally, Section 5, Prevention and Global Outlook.
So we know how to cure it, but how do we stop it from happening in the first place? Well, it takes a massive public health push focusing on WASH, water, sanitation, and hygiene. We're talking safe, chlorinated drinking water, proper sewage disposal, and universal hand washing with soap. But fixing infrastructure takes time, so the other half of the battle involves oral cholera vaccines. These are killed vaccines we roll out in huge mass campaigns to protect vulnerable folks in endemic areas or right before an outbreak hits a disaster zone.
Let's look at how this scales in the real world with a few clinical scenarios. Say a child comes in with moderate dehydration. They might bounce back beautifully with just ORS and some zinc. But an adult rushing in with severe cholera and shock? Totally different story. That requires an immediate pivot to rapid IV fluids and targeted antibiotics. And if it's a pregnant woman with severe cholera, the protocol shifts again to strict hospital monitoring to protect both mom and baby while aggressively replacing fluids. The tools change, but the core mission, rapid rehydration, is exactly the same.
I really want you to lock in on this quote directly from the Global Clinical Guidelines. Cholera is a preventable and treatable disease that can become life-threatening within hours if dehydration is not corrected. That right there is the absolute essence of cholera. It is incredibly fast and highly lethal if you ignore it. But if you recognize it early and rehydrate fast, it is 100% treatable.
Which leaves us with a pretty heavy question. Since we have the life-saving tools, the vaccines, and we know exactly how to prevent it, if the absolute best cure costs mere pennies and prevention is literally just clean water and soap, what is it going to take to finally close the global sanitation gap and end this ancient disease for good? It's a massive challenge of infrastructure and global equity. Thank you so much for joining me on this explainer. Let it serve as a reminder of how far our medical science has come, but also how much vital work we still have left to do.